What are the updates on CAR T-cell therapy in the treatment of adult patients with non-Hodgkin lymphoma? So I covered that at this British Society of Haematologic scientific meeting. And one of the two things that I wanted to cover were the pivotal phase 1-2 studies that led to FDA approval of 2 CD19-directed CAR T-cell therapies for the management of relapsed refractory large cell lymphoma. And then secondly, cover our current experience with standard of care CAR T-cell therapy in the same patient population. So as I mentioned, I covered the 2 phase 2 pivotal studies that led to FDA approval of Axi-cel for the treatment of adult patients who'd failed at least 2 lines of therapy with lymphoma, and then Tysogen silacleucel, which is the other agent that's currently FDA approved in the US for the management of refractory or relapsed large cell lymphoma, again, in the same setting, 2 prior lines of treatment. So I covered the data that was presented at ASH this year and recently published with longer follow-up that suggests both agents are fairly similar in terms of durability, with about 40% of patients having durable remissions, suggesting this is definitive treatment for patients with lymphoma. We also looked at the safety, which is hard to compare across the studies because there were differences in terms of grading that was applied. Along those lines, I discussed the most recent consensus from the ASBMTR that now defines what cytokine release syndrome is and neurotoxicity, which are the acute toxicities associated with cellular therapy, and defines the consensus on grading. So moving forward, though it's hard to compare the toxicities across those 2 pivotal phase 2 studies, there should be agreement on what is grade 2 and 3 cytokine release syndrome and neurotoxicity. And then lastly, I discussed our current experience with standard of care therapy, now having 2 agents that are FDA approved. We looked at about 300 patients who'd received Axi-cel therapy in the US across 17 centers. And again, despite about 43% of patients not meeting the eligibility criteria of the prospective studies, the safety and efficacy looks quite comparable.